Let's talk about Tourette's.
Oh, yeah, this is a good topic. I know you've been wanting to talk about Tourette's for a while now.
Yeah, so it's actually one of my favorite things to treat. It consists of three things: ADHD, OCD, and tics.
And you have all of those.
Oh, dang. Okay, let's just put it out there. I most likely have Tourette's, right? I was never diagnosed with it, but as a child neurologist, I do have tics. I have simple tics, complex tics. I have ADHD. I definitely have OCD. I remember as a kid growing up, even just walking on tiles, like you don't want to step on the line, needing to check something multiple times. Like taking a test takes me a while because I need to check the answer multiple times. And of course, we've talked about the ADHD part of it. In terms of tics, it doesn't always have to be blurting out words, yelling out words, or anything like that, like we see on TV. It can be as simple as like skin picking. I pick at my skin, on my hands, on my face. I think I've done that my whole life.
Yeah, like any repetitive type movement or, I mean, the skin picking, he doesn't even know he's doing it sometimes. It's crazy. I'm like, stop. And he's like, oh my gosh. He's like, if you see me doing it, remind me to stop because he doesn't realize it.
Yeah, it can be a throat clearing. I see a lot of patients that come in and their parents will say, I've been to the allergist, I've been to the ENT, but he has this throat clearing that just won't stop, or a sniffling that won't stop. And then you get into it as like, are we hyperactive? Are we inattentive? Do we get obsessed about things? And boom, that's like your triad of Tourette's. The key thing is it's okay. I personally think that a lot of successful people have Tourette's, OCD especially. Things have to be perfect. We don't want it to be like that, but we have this like drive to want to be the best at anything we do. But it's also working with the people around you to make sure you don't get fixated too much.
Yeah, but it's manageable. It's definitely, I guess we can talk about a little bit how to manage it and what has been successful for you or worked well for you.
Yeah, I think the main thing for me is slowing down, self-reflection. I think if you realize you're getting stuck and doing something repetitively, I've learned to realize it or have people around me that are not afraid to call me out. I love that. I love being told that I'm not doing something right or I'm doing something too much. And I think that's what keeps me in my lane or in my boundaries, or it keeps me sane.
Yeah, yeah. Especially some of the obsessive stuff. Like it's like, okay, well, let's I don't know, focus on something else for a while.
Why are you laughing about it?
No, I mean,
yeah. Wait a second.
Okay, one example is really, it's a good thing though. I think it helps you be successful and helps the people around you. Like Blake, our oldest son, has really gotten into swimming, and so literally Shaun became obsessed with making him an amazing swimmer. So he bought like 40 or 50 swimming books, all this gear, all this swimming gear, everything started showing up from Amazon. So Blake had a swim instructor and she was coming twice a week to the house and she would see all this stuff. She's like, oh, I can't believe all this amazing stuff that y'all had. Like, she would just pick stuff up. She's like, where did this come from? Oh, that, he just ordered that. But
so like compulsive buying.
Yeah, but it's just because he's like really focused on Blake being amazing. And then Shaun says he's going to be the best virtual swimmer.
Yeah, because
everyone knows he can't swim.
I can't really swim that well, but I will become the best virtual swimmer. What that means is I can make anybody better at swimming. I can make them faster. I can see it's that OCD. I can see one side is more favored than the other. I can see when you're looking up when you're supposed to be looking down, and it can be like a fraction of a second. So one day I'm going to open a swim center to make everybody better, including adaptive swimming. So yeah, goes along with my obsession. I'm obsessed because my son, he's obsessed with it. He loves it.
He got that from him for sure.
He got that from me.
He gets very like focused on certain things,
yeah.
And so now this is like his thing, and he's thinking about it and studying, and he has a notebook, and so Shaun will like give him notes or tell him, give him feedback, and he'll write it in his notebook, or if his swim instructor gives him feedback, he'll write it down, and then he like studies it.
But I don't force him to do anything, and it goes even a step further. You know, Blake, the reason why we connect so well, he's 10 now. At age 2, 3, he started doing a lot of facial grimacing, kind of like that, hard blinking, and it was often, and a lot of toe walking. And he's definitely hyperactive, inattentive, obsessive. So that's your triad of Tourette's. So I'm thinking this guy got that from me, but it's been a superpower. And people say, oh, you can't say superpower, but you know what? It has been for him because he excels in whatever he does because he uses this triad to his benefit. So yeah, the compulsive buying of swim equipment and books, I utilized it because he said he wants to be an Olympian, and he's never said anything like that. So let's go
see
with
what
it.
happens. Yeah.
Yeah.
Yeah. So maybe a couple years down the road, we'll have a natatorium because that's the next thing
I
that
am
Shaun wants to
been
build.
obsessing about that,
Yeah.
but it's really a natatorium for the city of Houston for anyone to use. Where do you go to use a swim lane right now? It's almost impossible. So I did a Google search and seeing like where could we go. A lot of it's expensive. They're like Klein ISD has a bunch of natatoriums, but even renting it out, you have to give them a certificate of insurance. What family has a certificate of insurance with a $3 million policy to cover, damages or something? So it's not really obtainable. So the obsession part of the Tourette's and OCD is now making us look at providing a natatorium experience for Houston. So the ADHD part of this conversation has got us from Tourette's into a natatorium, by the way. So, but hey, this is us. This is me.
Yeah.
And in the end, Tourette's is okay. OCD, ADHD, tics. It's okay to have it. You don't have to treat it. The only time you have to treat it is if it's causing anxiety or social angst for the child or kid. It usually starts around 3, gets worse around puberty, 12 to 13. And then as you get in your 20s, it starts to get a lot better. So you don't need to start medicines for it, which there are plenty of options to treat it and make it better. But you only have to use it if the tics are happening so much that it's causing pain. I've had a couple of patients where they'll do like a breath holding type of tic where they'll do it over and over and over again. And their diaphragm, and their chest, their rib cage, everything hurts. So if your kid is having tics and it's causing pain, that's a reason to use medicine to make it less. And then once that pain goes away, we can talk about it as in, do we need it anymore?
Or certain situations, there is like a social aspect, right? Where if it's a very severe, repetitive tic that is noticeable to peers, especially when they are in school and the kids feel embarrassed, that could be a reason to consider treatment also.
Yeah, no, I think that's a good point. You don't want them to be have an affected self-esteem because of their tics. And the other thing is, don't keep it from them. I have families that will notice the tics in their child, and the parents will talk about it, but they won't talk about it with the kid. The kid knows. I mean, we all understand that if we're being talked about. I've learned that just talking to the child or the young, the teen about it and empowering them to own it and it's okay, that alone reduces tics because now they're not scared that their parents are talking about their tics. So talk about it as a family and then reach out to your pediatrician or family practice provider or a child neurologist and go visit them, because I think the knowledge of what is Tourette's and how the natural progression of it goes provides confidence that it's going to be okay.
Yeah.